Hello, I am Shakti Suprayukti, working as a Msc Tutor in Sri College of Nursing in Sri University. So today I discuss ancient topic, wound healing stages and influencing the factors. So firstly to know about the what is wound healing and what are the learning objectives to know after studying what students to learn, able to know define wound dressing, wound healing, then explain the stages of wound healing, then describe the local and systemic factors influencing wound healing, then identify the complications of delayed wound healing, and explain the role of the nurse in promoting the wound healing. Then to know about the introduction of wound healing. Wound healing is a complex, dynamic, and orderly biological process. Then it restore the integrity of the skin and underline the tissues after injury. Then the proper wound healing is essential for the prevention of the infection and complications. Then to know about the definition of wound healing. Then what is wound healing? Wound healing is the process of the tissue repair and regeneration following injury involving cellular, chemical and vascular responses. Then to know about the types of wound healing. Types, it is mainly four types: open wounds, closed wounds and acute wounds, then chronic wounds. Open wound, what are there in open wound? Inserted, then lacerated, then puncture. Then in closed wound, what to know? Contusion, then hematoma. And acute is normal wound, then chronic is severe, as like diabetes ulcer, then pressure ulcer. These are the chronic wounds. Then what are the stages of wound healing? Stages is mainly four stages. First, number one is the homeostasis, then inflammatory phase, then proliferative phase, then maturation phase. Then firstly to know about the hemostasis. In hemostasis is the occurs immediately after injury, then vasoconstriction reduces blood loss, platelets aggregation forms the fibrin clot, then provides a framework for the cell migraine. Already see the picture at there, but how hemostasis is occurs. Then to know about the inflammatory phase in second stage of the wound healing. It begins within the hours, last 3 to 5 days. Then vasodilation increase in the blood flow. Then neutrophils and macrophages removes the debris and bacteria. Then what are the clinical signs are see or sign and symptom? Redness, heat, swelling and pain. Then third stage of the wound healing is proliferative phase. It will last from the 3 days to 3 weeks. Then fibroblast synthesize the collagen, and also what occurs? Granulation, tissue formation, then angiogenesis and epithelialization occurs. Then for stage 4. Stage 4 is the maturation or remodeling phase. Then it is begins around the 3 week and maybe last of the 3 month to the year. Then collagen fiber reconstruction and the strengthens. Then scarce tissue mature and also tensile strength increase up to 70 to 80% of the normal tissue. Then what are the factors influencing of the wound healing? Mainly two factors are affecting the wound healing. Number one is local factors and number two is systemic factors. Then firstly to know about the what are the local factor influencing the wound healing. Then first one is the infection occurs, then poor blood supply and oxygenation, then moisturizer imbalance, then presence of the foreign bodies, then size, depth and site of the wound, and also what are factors, local factors occurs, pressures and repeated trauma also occurs. These are the local factors also affecting the wound healing. Then to know about the systemic factors influencing the wound healing. Age like delayed age, like elderly also delay wound healing. Then nutritional status, chronic diseases like diabetes mellitus and anemia. Then poor circulation, what are the medication, corticosteroid and chemotherapy. Then smoking and alcohol use also occurs. Then to know about the role of the nutrition in the wound healing. What are the role of the nutrition? protein what can do? Tissue repair and collagen formation. Then vitamin C also collagen synthesis. Then vitamin A, epithelialization and immune response also occurs. Then zinc is the cell division and immune function. That all are the nutrition for the prevent the wound healing. Then to know about the complication. What are the complication occurs in the wound healing? Infection, incisional hernia, then hypertrophic scarring, keloid scarring, then contracture. These are the complication occurs in the wound healing. Then what are the nursing responsibility in the wound healing? First one is the assess of the wound size, color, exudate. These all are the. Then maintenance of the aseptic technique. Then monitor the sign of the infection, then provide adequate nutrition and hydration, then provide the patient education on the wound care and hygiene. Then what are already we discussed, what are the introduction of the wound healing, what are the definition of wound healing, then mainly types mainly already know 4 types. Then what are the stages also 4 stages. And lastly we discuss the what are the factors affecting, mainly 2 types of factor mainly affecting. Then lastly we discuss the what are the main nutrition for the to prevent the wound healing. And lastly what are the role and responsibility of a nurse to for the wound healing. This all are the we discussed. Then lastly, conclusion is the wound healing is a systemic and continuous process. Then understanding stages and influencing factor helps nurses to provide the effective care. Then proper nursing interventions promote the faster healing and also prevent the complication. These all are the discuss the wound healing stages and influencing the factors. Then refer to this book to know about the wound healing. Then lastly I say thank you.